right, welcome back to Living Vividly. Today we are joined by Dr. Thomas Bond. He's a family medicine physician here in Lafayette, Louisiana. He's a leading practitioner in regenerative medicine. He's the founder of Bond Medical Center, formerly Total Care Health and Wellness, and the Regenerative Medicine Institute of Louisiana. Thank you for being here today.
Thanks for having me. My pleasure.
So tell us a little bit about what regenerative medicine, what does that mean?
Yeah, it is a subspecialty of medicine that I got into from the sports medicine side.
Mm-hmm. So you were originally sports medicine?
Sports medicine,
okay.
Yeah. I did do family medicine as a residency program after medical school, and then went into sports medicine at Duke, which was much more orthopedic focused. And then from there, it got just further and further down the track of orthopedics and musculoskeletal care, what we term orthopedic medicine. So I was a former president of the American Academy of Orthopedic Medicine, which is interventional orthopedics without surgery. Okay. So from the regenerative medicine perspective, regenerative medicine starts basically in the musculoskeletal realm, because it's the musculoskeletal realm that gets injured most often, right? And that oftentimes is in sports or in physical activity. So let's say you tweak your knee and you tear a ligament. The standard of care in the United States forever has, well, I shouldn't say forever, actually, maybe just the past 40 or 50 years, is to do orthopedic surgery if that case warrants it. Prior to doing, back in the 20s and even before that, before we had the ability and know-how to do surgical reconstructions of joints, there were actually techniques done by the Germans, and even predating them, things all the way back to some of the first Olympics. They would actually burn people's rotator cuffs to try to tighten that rotator cuff that was torn, or a loose shoulder, right? There was all kinds of things that probably wouldn't be.
When you say burn, what are you meaning?
Like a capsular shrinkage in the shoulder, meaning that people who threw the javelin, if you throw anything enough,
right?
Ask any baseball pitcher, your shoulder will become very loose.
Yeah. So ironically, my husband has had shoulder issues, and he went to you. This was years ago, and he basically came home and said, "I can't throw the football with Alex anymore because he told me that throwing is going to degenerate the shoulder."
Well, if it's a loose shoulder, right, and you continue to do an activity on a loose wheel that's wobbling, right? I love to use the wheel analogy because everybody drives, and so everybody can figure it out real quick. Like, if you loosen the lug nuts on a car, right, the wheel wobbles, the tire is going to get eat up much faster than it normally would because it's unstable. So an unstable joint leads to arthritis. Okay. Now, going back to what is regenerative medicine. Regenerative medicine is using techniques and interventions to stimulate the body to try to heal the problem.
Okay. So it makes me think of, y'all remember that movie Cocoon? Mm-mm. It's an older movie. Do you know what movie I'm talking about? Where it's like an older generation of people, and they go into some kind of
the cocoon and regenerate,
right, and regenerate, and then come out a new, younger person.
So all of us, we're not there yet.
That's what you do? Oh.
We're not there yet. But all of us regenerate.
Okay.
Right? Scratch your arm. Wake up tomorrow. It's better, right?
Mm-hmm. Break your toe.
Break your toe. It's not going to be better tomorrow, but it will be
eventually
better. So your body wants to heal. It does so mainly at night when you sleep. That's part of the reason we sleep, is to regenerate the body, move all the dead cells. You bump into the doorway, you kill 1 million cells. Those cells all have to be cleared. So that's done by your immune system as you're sleeping. Okay. So the concept of healing and regenerating and even longevity, living longer, that all stems from the regenerative process in the body. Most unfortunately, as modern medicine, specifically allopathic medicine in the United States, it's what we call the practice of medicine in the United States.
Just traditional medicine
is pharmaceutical based. And pharmaceuticals are based, their whole idea is profit. Right? It's based on the profit motive. And so when you have one of the most common medications, probably everybody in this room has taken it in the last month. I hope not, but probably something called ibuprofen, which is an anti-inflammatory. Well, by definition, it's anti-healing because the body heals through inflammation. You cannot heal without bringing the cells to the inflammation is basically calling 911, and they all come to your office location, right? Right. That traveling, that congestion, that swelling of the parking lot, that is inflammation.
That's why Jackie's toe is purple.
That's
and
why
I
Jackie's
refuse to take ibuprofen. I'll have you know.
Well, very
I don't know
good.
if that's a good thing or not, but it drives my
it's a
husband
good
crazy.
thing. It's an absolutely a good thing because you're trying to heal.
So should we not ice things?
Ice is different. Ice, most people think of ice as being anti-inflammatory. What it really is doing, unless you leave it on for hours, what it's really doing is numbing these superficial nerves. And so ice helps pain way more than it decreases inflammation.
Okay. And it's just by numbing the nerves around the inflamed area.
The superficial nerves.
Okay.
Yes.
So you're saying it doesn't decrease inflammation enough to warrant no ice?
Well, what I'm saying is, again, if I packed your whole body in ice, then yeah, I'm sure we could slow down some healing. But most people aren't doing
enough,
that, right?
yeah.
So if you sprain your ankle and it blows up the size of a watermelon, yeah, go ahead and put some ice on it and elevate it and do those things. But realize when you're doing that, that should be for pain, right? Because God made it swell, right? I tell patients all the time, God made inflammation, man made Celebrex, right? Man made ibuprofen. So those things, and the funny thing about it, I've always found this so curious. When I was at Duke, I realized this real quick. Like, there's no way that we should be doing. All these guys are getting injured, and we throw them in ice, and we give them ibuprofen, and that just doesn't make any sense. I mean, just look at the healing curve, And you talk to any orthopedic surgeon in town or anywhere in the world, and you ask them, "Hey, look, I broke my toe. Should I take ibuprofen?" Well, probably for the toe, they wouldn't care. But let's just say something big, like, I broke my humerus or I broke my femur. Should I take ibuprofen? And they will unanimously say, well, no, that delays fracture healing.
Oh, okay.
Yeah, my husband just had a spinal fusion done last year, 2 years ago maybe, and it was like a year of no ibuprofen.
Right. So what does that tell you? They absolutely know that it will inhibit the healing. And in that case, it was a fusion. So it's not like a broken bone. What they're concerned about is they're drilling into the bone. And if that drill bit doesn't, get accumulated into the bone, and it doesn't get healing around it, you won't have a solid fusion. There'll just be a hole and it'll just slide in and out. And you start backing out of the screw and the whole thing. So that's a perfect example. But if you say, hey, I tore my ACL, what should I do? You just take some ibuprofen. Well, it doesn't make any sense. I mean, bones don't heal differently than soft tissues or muscles or tendons or ligaments.
They all heal the same way with the immune system going there to
Correct.
support and bring its baggage to that space so that it can heal
It's
it.
toolbox.
Tools. That's a better word. Yeah.
The only tissue, so all tissues in the body heal the same, except one, and we don't really know this, but there seems to be some evidence, is central nervous system tissue, so the brain.
Okay.
The brain doesn't like anybody. It's a very selective club. It doesn't want anybody coming in there.
Mm-hmm.
So anytime you have white blood cells come in, it doesn't like it. Anytime you have lymphocytes or, they have to patrol the area, but they just don't like anybody in their neighborhood.
Mm-hmm.
And they'll scar before they'll heal.
Oh.
And so that's why the brain is very sensitive to any type of insult. So it doesn't take much for the brain to scar.
So you're saying acetaminophen's better than ibuprofen?
Acetaminophen is a better choice to not decrease inflammation because it doesn't affect that inflammatory cascade.
It just tricks you into thinking it doesn't hurt.
It's an analgesic. Well, no, I mean, it is an analgesic, but there's a difference between an analgesic and an anti-inflammatory, right? So an analgesic just stops pain or helps to reduce pain, whereas an anti-inflammatory actually hits and inhibits some path somewhere along the inflammatory pathway or the inflammatory cascade. So either cyclooxygenase or the leukotriene pathway or any one of those pathways.
Is there ever a time where ibuprofen would be appropriate?
Sure. And I tell people all the time, like if you're having a horrid headache and you're supposed to have a big day and you're supposed to be interviewing this doctor or whatever, right? And your head is pounding and you don't take ibuprofen every day, right? You take it only sparingly. That would be an excellent time to take it.
Okay.
Why in that moment ibuprofen instead of acetaminophen?
Because we know it works pretty well on pain.
Okay, gotcha.
And it's a short-term, one-time thing.
Right, it's a one-time thing.
You're not trying to heal something.
You're not going to continuously be decreasing. They did a study on ibuprofen with a bunch of medical students. Go figure. So what they did is took all 100 med students and said, if anybody has any pain whatsoever, you can't be in this study. Right. So these are 20-something-year-olds that are completely healthy. They have no problems, not on any medications. They all took ibuprofen 800 milligrams twice a day for 30 days.
That's a lot.
Well, that's the dose. I mean, that's the
800
typical.
twice?
Typically 800, 1,600 a day would be the typical
Okay.
dose and frequency for acute pain.
And they all develop stomach ulcers.
Good thought, but no. But they all, much more interestingly, is that they all developed pain.
Ooh.
Oh my gosh.
When they stopped taking it or while they were still taking it?
No, towards the end of the trial, right? They all had pain. That was their number one side effect during the 30 days was pain. And why do you think that is? It's because they weren't healing. They weren't regenerating at night. So they were like everybody here, you hurt yourself every day, whether you know it or not. You're doing things, you're bumping, scratching, whatever. Right. And on a cellular level, you're killing millions and millions of cells every day. So that has to be repaired, and that gets done at night. This is also why sleep is so critical. So from my perspective, as a sports medicine special, orthopedic medicine guy, and I'm doing these regenerative medicine procedures, and I'm wondering, okay, why is this? I know what I'm doing works. Because you say, well, how would you know that? How would you know that 20 years ago when no one even heard of a stem cell? How did Tommy Bond know about it? Well, because I had it. I was patient number one. So I was told that I needed neck surgery and back surgery, and I knew the statistics, and I said, no, I'm not doing that. No way.
And that was from an accident, a car accident?
Yeah, several car accidents and jumping out,
Just a life.
We don't have enough
time. Got you to that? Okay. So it wasn't a one individual thing that happened?
Multiple. I was an adrenaline junkie, some would say, or just incredibly clumsy or incredibly unlucky, right? I think it was a combination.
Combo of all
it was
three,
definitely a combo, But I knew I couldn't have 2 3-level spinal fusions or I would never practice medicine. This was the very beginning of my career. So I went around the world doing medical missions and talking to different doctors from different countries. And that's when I found that, the Germans were doing this type of stuff, not with stem cells, not even with blood-based growth factor concentrates, but more just proliferative therapy, prolotherapy, regenerative injection therapy, all the same, using different solutions that would stimulate the body to heal. Or another way to say it is to piss off the immune system. Okay. So this led me into much more of a non-interventional regenerative orthopedic medicine, right?
So you realized that the way that you were taught with surgeries was not the right way, or suspected that it wasn't always the best path, that potentially there was another path. And so kind of what I'm gathering and what I know about you is that you realize there's another path, and then went on a quest to find what is needed how can we support the body in a way that's
the way I say it. Okay. we are current still to this day, 20 years ago and to this day, we have a situation in our country where we have what's called conservative care.
Mm-hmm.
And conservative care could be everything from home exercises to chiropractic to physical therapy to medications and everything in between, right? That's called conservative care. Then from there, you have major surgery.
Right.
There's this big gap of treatment options, in my opinion, and the opinions of people that do regenerative medicine, right? We're like, well, what happened? How is it that you you have a shoulder issue, you have a rotator cuff partial tear. Well, what the surgeons will say is, well, it's just a partial. I mean, they know, like, oh, it's just a partial. We don't need to operate on this.
Right.
Right. So, but what do? The patient's not happy. They're hurting. They can't throw the ball with their son. They get, all right, go to PT. So then the poor PTs will get, they got stuck with the ball, and now they've got to figure out how to do something with it. And some of them are so damn good that they can actually figure out how to get that patient to get around it. And then over time, hopefully with good diet, good sleep, and the proper stimulus, good nutrition, good hormones, etc., all things come together. And then, hey, this thing, we could actually heal this little 20% tear.
That sounds like a lot of variables, though, that most people aren't doing.
Right. That's assuming that's best case scenario, right?
So when you look in the mirror, what you're looking at is an incredibly complex machine with a million variables a second. And I'm probably, underestimating by a factor of 10.
Right.
Right. So certainly you can't control the variables, but the variables that I was speaking of absolutely affect the body's immune system and the ability of it to heal. Okay. So that piece that can only go so far as the conservative care model. It can just only go so far. The problem is there's a large gap, this big gap of clinical entities that don't need surgery. So example, a 30-40% tear, 50-60% tear, those will not get better. I wish they would. They won't. Okay.
Because the rotator cuff specifically doesn't have the ability to regenerate.
It's not going to do
itself.
50% tear. So the surgeons will say, well, we need to take that to the operating room. And that's okay. That's what they know.
That's how they were trained.
They were trained, and that's how they think. And guess what? That is the definitive treatment. It will work, right? If they take it to the OR and they sew the tear up, then it's going to work, right? Assuming all things being equal and it's done correctly, et cetera.
Right.
So that's great, but that's a big procedure on a patient, and it costs somewhere between $50,000 and $100,000. So as an overall cost on the society, that's a big cost, right?
Well, and then being the daughter of a mother who had rotator cuff repair, she's now not able to fully take care of herself. The patient is not able, while they're recovering, there's
a cost to other people.
Right,
Yeah.
a cost to other people because they can't fully, she has a hard time brushing her teeth and cooking meals for herself. So she can't really, in that time period when she's healing, there's a lot that has to happen from other people, a lot of support. And help.
Social cost.
Social cost, yes.
Yeah. Okay, so coming back kind of full circle as far as, we talk about what regenerative medicine is. It's trying to offer a group of services, interventions in this case, because what we offer is actual interventions to fill the gap, to try to heal without surgery. Okay. So that's what I'll call, interventional regenerative orthopedics.
Okay.
Now, what about the cocoon example, right? That this whole idea of longevity and how we can, that's the other half of our practice. There's lots of different things that you hear people talking about, and a lot of it doesn't have data. Some of it does. Most of the data, which people inappropriately project into the human population, is done like on Drosophila, or earthworms or fruit flies or lizards or something. So, people ask me every day in clinic, hey, should I be taking, pick anything, peptide XYZ to help me live longer? Like, well, if you were an earthworm, I could say definitively yes. But because you're not, I can say it's anyone's guess.
Right.
So, you have to be careful as a practitioner that people trust, and they come to you and say, hey, what should I take for X, Y, or Z? You have to try to set expectations and say, listen, I know this is big on TikTok, and I know that people are all about this, and that, but the truth is we don't know right now. I can tell you what we absolutely do know that will make you live longer. I mean, that
what are those things? Tell us those.
Okay. So no question, no doubt, by far, nothing even comes close to the number one longevity hack there is, drum roll, is exercise.
Mm-hmm. Boring,
right? No one wants to hear that, but it is absolutely powerful, incredibly powerful. So it's not just exercise, which no one does because it's too hard of a definition. Anybody know the definition of exercise?
Okay. No, but I will say that my other friend, Jackie, she says she'll always tell me, please don't tell me to exercise. Just tell me to move or be more active because it's a little less harsh. Yeah. So I don't know what the definition of exercise is.
So it's harsh.
Is it to remove demons from someone's body?
It's worse.
To exercise.
It's worse. Yeah. Close, though. It is. Here we go. Increase. So it's any physical activity that increases your heart rate to greater than 70% of your maximum heart rate.
Oh, okay.
Sustained. There's the key word. That is the key word. Sustained. That means you get it up and you keep it up for a minimum of 30 minutes.
Tennis.
A minimum of 5 days a week.
Mm-hmm.
Okay.
So I knew the 30 minutes, 5 days a week, but usually I didn't understand the sustained 70% of maximum heart rate because that's a lot. That's hard.
Yeah, it's pretty
that's
tough.
high.
And the easy way for folks that are listening to say, well, how do I know what my maximum heart rate is? It's 220 minus your age. Now, that's kind of weak, to be honest.
Yeah, that's what I've always heard.
In sports medicine, we don't use that because it underestimates an athlete's ability to reach and maintain heart rate levels. So, but we, for the general population, we usually will say 220 minus your age. So I'm 55. You do the math. I should be in the 120s sustained for a minimum of 30 minutes just about every day. Mm-hmm. And, that's kind of hard to do.
220 minus your age?
Yeah.
You're 55?
Yeah.
That's like 160.
Times 70%.
There we go.
There you go.
Yeah.
Forgot about step 3.
You'll get there. Excuse me.
Jackie was sneezing and I couldn't understand.
My head just exploded. I tried to hold it in. It was really dramatic.
So that, the way that I got into that, of course, I was, I did a master's. I did a PhD program in physiology and biophysics before I went to med school. Ended up getting out with a master's. So I just love physiology. And so I was always big on exercise and exercise testing and tolerance and that kind of thing. And that is so the number one, if you said, okay, I want to know, hey, I'm 55. I want to know where I'm line up, where do I match up? How long am I going to live? Well, the way to do that is to do a VO2 max test, which is, a test where you run on a treadmill or on a cycle, you go on a cycle until you go to failure and you're measuring the inputs of gases going in and out. And then we can say what your maximum ventilatory reserve is, or cardiovascular reserve. And the statistics will show.
People want that?
Well, some people.
Yeah.
Not many. I had a lab. I had a lab here for the past 18 years. Well, I took it down last year. So 17 years, and I probably did 50 patients in 17 years.
Wow. I was about to ask if I could do it.
I know. I was going to ask, what's the best way to get our VO2 max? Because I would love to know what mine is.
You want to know how long you would live if you stayed healthy?
It's not how long you would live.
No.
What it is you can look at age match control. So you can say, okay, at 55, if my VO2 max is 80, I'm going to outlive every other person in this town.
Oh, you just have okay. How
It's
healthy you
how healthy you are,
Yeah, I
how
gotcha.
fit you are.
And you can improve that.
It's not going to
right?
say
Like,
you
it's
have
something you
Yeah.
could-
It's not going to
You
say
can.
you have like 12 more years to breathe.
Well, it's not.
No, it
come
does
on,
not say
Dustin.
that. So okay,
That's what it felt like.
But that's the and I may have said it that way, and I apologize. But
I
You
also-
probably didn't,
I
Dustin.
also don't
No.
listen very well.
Yeah.
so let's talk about some other things because that one's hard.
Okay,
Yeah,
well,
exercise.
so I want to know where, and I'm sure you're going to bring this up, but diet and nutrition, I want to know how that fits in.
I'm coming.
Okay.
Again, far and away.
So you put exercise over nutrition.
There's no question.
Real exercise, though, like heart
it's
rate.
Not, hold
Okay.
on, it's not me.
Okay.
It's not me.
Okay.
This is the data.
Okay.
There's,
You're
there
just
is-
talking about general health too, not necessarily
longevity.
losing
For
weight
longevity.
right.
No. This is if the longer you go on a VO2 max, the longer you live. Period. And that's the shorter you go, the shorter you live.
And that's throughout your whole entire life. Because
That's-
I've kind of thought about, and I've said this is my opinion, okay? Because whenever I say this, I always say that this is not necessarily the data. This is my opinion. That nutrition gets you to about 60-ish, and then exercise takes you the rest of the way.
Wrong. Oh, sorry. Sorry.
Okay.
It's just not supported by the
Yeah,
data.
okay.
You know.
So tell me what the data says so I can be correct.
So the next thing is that if it's fatness.
Okay.
So the fatter you are, the less you live. So in other words, the leaner you are, the longer you live.
And so is that does it differentiate in different types of fat
Like visceral
versus
fat?
visceral fat versus subcutaneous fat, or is it just fatness in general?
Nope. It's
Like body fat percentage.
It's body fat percentage.
Okay.
So it's 8% in a man, 12% in a woman, a female.
So that's what we're aiming for.
Under that.
Under that
would be in the top one. That would be the top 5%.
There needs to be an over that though, right? If you have 0% body fat,
Yes.
that's unhealthy.
Correct.
So there's a range.
No one has 0% body fat.
Right.
But there would have to be a range
what's
for
the-
both of what's considered healthy, right?
Well, wait, we're not talking about healthy.
Okay. Tell us. Okay, reframe that
Yeah,
for us.
this
Tell
is-
us what we're talking about.
If you have 0% body fat, you live forever.
No.
Well, we hadn't found anybody yet to know, but
Right?
yeah. So no, we were talking about longevity.
Living
Okay.
longer.
So living longer, right? And what the data will say as far as living longevity, number one by far is exercise tolerance.
Mm-hmm.
And we talked about the definition of exercise, right? And not, what tolerance means is that you can operate at very high levels of physical activity, power, timing, function with high heart rates and still be able to have a good output without it degenerating, right?
Right.
That's what you see on these cyclists and mountain marathon runners and these kind of folks. Okay, so that's number one. Next is leanness,
Okay.
right? And so leanness in a man is defined as less than 10% total body fat.
Okay.
In a woman, less than 12%. Those are hard to get to.
I was going to say I do body fat percentage in my office,
Yeah,
and I
those
have never
Those are tough
come.
to get
I
to.
mean, those people probably aren't coming to see me, but never gotten anywhere close to that for most people.
Yeah. Well, it's because
Right. I know.
it's where we live. I can promise you we get that at Duke
Okay.
for sure. That's in with athletes.
Yeah.
And look, that changes with age, but the data doesn't. I mean, it's a bell-shaped curve. It is what it is, right? Third thing, when we talk about longevity or aging, trying to age a person, is genetics, right? Specifically, something called telomeres, which is the end of the DNA fragment. Telomere length is directly correlated to longevity. Okay? So that's something, objective that you can measure over time and say, okay, this is
How is that measured?
blood
It's
test.
genetic testing. We usually do saliva.
Okay, because I've done genetic testing, but I don't know that it had anything about telomere length.
Mm-hmm.
Okay. I'll have to go back and look.
Got to look.
Do you use SpectraCell? Is that who you do it with?
We have a SpectraCell account. We've recently been using another company, and the name escapes me at this point. But we have several that we use.
Is telomere, how did you say it? Telomere?
Well, some people, it's tomato. It's
Okay.
telomere.
Telomere.
Mm-hmm.
The length, is that something that you can lengthen, or is that definitive? Like that is the length?
No, that's a great question. So the answer is no, you can change your telomere lengths.
You just grab it and pull a little
You
bit.
just got to pull.
Stretch it.
Just got to get a massage and tell them to pull. It's usually, so that's, you've heard of epigenetics, right? So epi means above. So above the genome, there are these proteins that float around. And there are certain supplements that can affect that epigenetic biome, if you will. So that's kind of a whole another discussion. But the answer is yes, you can. There are several different products that have been shown to do that,
What about lifestyle things that can change your telomere length?
Such as?
Like better sleep quality or something that's not a supplement. Like a cold plunge or whatever kind of stuff.
So cold plunge, no. Infrared,
plunge?
no. Hot plunge, no. Those work on cold shock and heat shock proteins, which are super interesting. That's a very obviously you guys know you're on it, right? You see all this stuff that's people buying left and right, buying saunas and red light therapy and these things. And this is all just coming back full circle. This was not like taboo 100 years ago. This is totally what you did. And then it became, in the sanitariums of the 1920s and 30s when they did all these things. Now they did some other things too that would probably be considered.
I hate to interrupt you, but it reminds me of they used to have the thing that like shook you.
Yeah.
Like you say, and it's coming back
The belt.
because it's good.
Vibration plate, yeah.
And now they have the vibration plates
for lymphatic drainage.
And
I've
it's
actually, I know this is off topic, but I've been hearing.
we're all over the place here.
We'll get back to it, but I've actually heard a lot of negative news about the cold plunge lately, how it's causing, is it strokes or heart attacks, especially in men. It's causing something with the blood vessels.
Certain people have certain predilections to have vascular injury with cold exposure. So you have to, and I have Raynaud's. So, I can't go and do one of these, a cold plunge is one thing, right? But getting in these basically freezing chambers that drop they drop the temp, cryo chambers, and they drop the temp very quickly. So, your body doesn't have time to adjust. And a lot of times it'll just vasoconstrict. If you vasoconstrict in the brain, we call that a stroke, right? Or at least a TIA. So I've not heard of things like that lately, but it wouldn't surprise me at all. I mean, that happens probably almost every day in Sweden and Norway.
Oh, right.
When
just because the temperature is so
they go, the way that they do it is they'll have these saunas, right, that are multi-leveled. And so you walk up the stairs, but you're like a herd of cattle. Like you take 2 steps and then you stop, and you take 2 steps, you stop, and it's in a sauna. So the whole thing, you're just getting hotter and hotter and hotter as you get to the top. By the time you get to the top, you're like, dripping wet, and then you step out onto a plank and jump into the Arctic Sea.
That sounds like a special kind of torture.
Yeah.
Well, it sounds like a perfect setup for a heart attack to me,
that's what I'm saying.
and apparently some people do, and but they believe that to be something they've done for hundreds of years, and that's part of their culture. And I don't know what the data would show on it.
Yeah, thank you.
But a lot of those, the question was about epigenetics, and it's kind of the whole. It's much more supplement based. I would say that it could likely be nutrition based as well. So going to the nutrition piece.
So is that number 4? So we talked about exercise, fatness or leanness, telomere length, and then number 4. Okay.
4 through 27 are kind of all the same, and they're all, you could argue both sides, because there's meaning that there's some data to show that yes, this this is real. And then there's studies that people tried to repeat and say, well, this didn't work out. Obviously, with longevity data, it's going to be very difficult, right? You can't produce, humans take a long time to die. And so, especially big groups of them. And so to be able to have data that you could really point to that makes some sense in the human population is hard. But what they have looked at is here recently, the most recent study I saw, I didn't even know we were talking about this, but I just find it interesting, is when you look at longevity of the population as to compared to what they eat. I'd love to know what everybody here thinks because this blows me away. So
spicier the longer.
Okay, he's going spicy. Where are you going?
So the question is what foods or what types of foods?
Types of foods. What would you expect if you said, let's look at a population that lives really long and then let's see what they eat. What are they eating more of?
I feel like that would be so hard to answer because there's so many blue zones where people live a long time and they have completely different food sources.
So I'm going to give you a few,
Fish.
Not just one. I would say fish or like fat quality would be a part.
Okay, high-fat fish.
Fiber would be another part. No? Really? Yeah. What about vegetables or specifically like green leafy vegetables? No. Huh.
Red meat.
Red meat.
Oh,
so just recently, Hong Kong.
So
Hong
not
Kong
spicy.
is one of the. No, I don't think this spicy fell in there. I don't know. There's a study out of Hong Kong that shows that it per capita consumes more red meat than any other city in the world, but yet the population on average is older. Now, what does that mean? That I don't think you can draw too many conclusions from that, but it's certainly interesting because
worth exploring more about.
Oh, certainly, yeah,
Sure.
it goes. But it's worth exploring. But it really flies in the face of what American, the American Medical Association has said for the last 50 years, and what Bill Gates continues to say today.
I have my own conspiratorial thoughts about that anyway.
Yeah. And the reason longevity stuff is so important to me is because what you find is that this group of practices, foods, sleep, all the things that we know likely help this on the longevity side on this side will actually affect the immune system. And of course they would, right? Why wouldn't they, right? And what that means is it can affect my outcomes. So I got really intrigued with if I'm doing a stem cell procedure of why this patient is not healing like I know they should. And I call those the saboteurs, saboteurs of your own body, of your own system, and of my procedures there's several, but the biggest one is stress. And we all know that stress increases cortisol, right? And what is cortisol? What's the cortisol is the number one
cause of gray hair.
No, it's the well, I don't know, but I don't think so.
That's a lack of vitamin B5.
It's the number one inhibitor of your immune system,
right?
So it suppresses your immune system. When people are stressed, they're suppressed. And they can't heal. I guess smoking might be next, but that's not, a behavior. I guess it is a behavior, but it's not one that you would just consider like, okay, obviously I need these things to be healthy. Well, these things will affect my ability to heal. Your immune system has tons of inputs, right? So everything from pain, sleep, hormones, thyroid, and on can affect that immune system.
Right.
And the times that I've had patients who appear completely healthy and they certainly should have responded well and they're just not responding. And this was years ago. I mean, I've corrected all that now. I make sure that someone didn't just lose a spouse or a child, or they're going through a divorce, or they're you can't have
the major
stressors
of
immediately.
in life.
Nope, we're not doing this procedure. We're going to hold off until this is all settled down because it's not going to work.
Well, so let me ask you, if we're talking you're doing these things for injury specifically. I'm wondering how this correlates with the autoimmune diseases. So like I have Hashimoto's, you mentioned Raynaud's. What kind of therapies, or do you do these types of therapies to support the immune system when there's an autoimmune disease in play?
Yes. So be careful about autoimmune, right? Because we all think that auto means self. And so we think that it's going to, hey, we're attacking ourselves. The issue there is that it's not self. It just may be that we're letting some antigens in from the gut that go and grab onto the wrist, and then your immune system says, hey, what is that? And it attacks it. And then we call that rheumatoid, right? Or the way that I learned it in med school is it was like a rogue section, a rogue group of white cells in our immune system that have turned against us and they're attacking our joints. Well, that's not really true.
So how would you explain autoimmunity, like how you define it now?
Well, what I say now is that our immune system is attacking something that it believes to be not self.
Okay. Yeah.
Right? I don't think that it's a rogue cell. I just think it sees something that it says is not us.
Yeah.
And hits. I have Hashi's as well. And I can tell you that not just Hashimoto's, but rheumatoid, psoriasis, eczema, a lot of these things improve tremendously with the right diet. Right? Because most people that you see, and we all know, that live in Lafayette, Louisiana, likely have leaky gut. They likely have some permeability problem. It's just that's where we are. Try to go find some healthy place to eat in this town. It's not the
fried
easiest.
everything.
Few and far between.
It's tough. So you'd say, what kind of interventions would you
like
have
what kind of
for that,
therapies do you have to support that?
So first and foremost, you got to stop take out the fire, for God's sake. Stop the ensuing incident that continues to burn. So if we could say, okay, gluten-free, dairy-free, GFDF, which is, again, hard, but if you do it, those patients have a overwhelming
much better
majority
response.
of patients get better. They're not healed, but they get better. And then from there, it's, okay, that's first step. Then from there, what else can we do? There are some things like with Hashi's, you can do oral peptides. Like BPC 157 is a good gut healer.
Okay.
That's also really for eczema, psoriasis, any of the gut skin issues. You see that can help. Injectables you can get to. Then you start getting into, when you look at these quote unquote peptides, this could be a whole nother series, but the peptide thing is so funny to me because, all they're doing is copying what the pharmaceutical industry stole from the Russians, and then they're going to say, we're going to make this peptide, we're going to call it something else and charge $35,000 a month for it, and we'll do it high dose, and we'll do it for, say, psoriasis. That's the game plan of all of Big Pharma, and they've taken these peptides. That's what they are. But they take the peptide and they make a monoclonal antibody to it, and then they'll give you this.
Okay.
So they're not trying to heal you. They're just trying to bind the thing that's running around your body. So you're not trying to heal your gut. We're just going to bind up whatever your gut's letting through.
Okay.
That's what the pharmaceutical company is selling. Is that what you're saying?
We could agree on this, and this is a legal statement, that the monoclonal antibodies that are called drugs for autoimmune issues, they're not healing the body.
Right.
They're just keeping you comfortable.
Symptoms at bay.
They're treating to help decrease the symptoms.
And so the peptides, or I don't even want to say peptides, the interventions that you're doing are like stem cell type.
So what we do in my clinic is what I call interventional regenerative orthopedics. So that is an intervention. That's an actual procedure that I do to people, right? That would be stem cells from the bone marrow, stem cells from fat, or blood-derived growth factor concentrate. I know it's a mouthful. Otherwise known as PRP, platelet-rich plasma. PRP is a terrible acronym in my opinion. I've never liked calling it that from day one in 2006. It was not, didn't make sense to any patient, but anybody older than 20 understands what orange juice concentrate was or is. And so this is blood juice concentrate, right? This is blood growth factor concentrate.
I think that's what we should just call it, blood juice concentrate. I like that.
BJC, okay. Yeah. But those are the things we do. And each one of those has different little categories. Like if I'm treating nerves, we can crack some things and make it much more nerve friendly, right? If we're doing bone marrow, then I can do all kind of fun stuff with that and take out the growth hormone and take out IGF-1 and do a lot of different fun things. But that's mainly all for orthopedic.
Okay, I was going to say, what are the things that you are, like specific ailments or symptoms that you're treating? What are people coming in saying, I have this, and you say, this is the intervention that I would recommend? Right.
So on the orthopedic, the regenerative side, they have a meniscus tear.
Okay.
I ruptured my Achilles last year.
Perfect.
Okay. That's something.
It's too late for you, though.
Did you have surgery?
I did.
Yeah, you're done. So,
bye.
But if that Achilles was still hurting and there was scar tissue buildup, then we could
That's more of what I'm wondering, because
they're not going to want to. They've already cut you. They don't want to cut you again.
Right.
So they would just be like, "Oh, go to PT." And let them work it out.
Been there, done that.
The poor physical therapists. They're like,
sorry. We love you, friends that are PTs.
Yeah.
So it's those kind of. Is that what the question you're asking, or you're asking more on the other side?
No, like
why would someone go?
Why would somebody come to you? And I'm thinking because I have both of my parents have had major surgeries. So knee replacements. Both of my parents have two rods in their back because of degenerative joint disease. So obviously it's too late for them, but at what point would they have, what would they be coming in saying, I have back pain?
So here's a perfect example. Your parents are a perfect example. So there are plenty of patients that I see that come in post-operatively, maybe years down the line. They've had 2-3 fusion surgeries in their back. Their poor backs look like I-10 and 49.
Yeah.
They got on ramps and off ramps. I mean, it's just scar everywhere. And so what you find with a lot of these patients is that the majority of their pain is actually coming from soft tissue that never healed.
Okay.
Because it got scarred so many times. I always tell people that the human body, if you can imagine, you know what a dosage cake is, right?
My favorite kind of cake.
A multi-layered cake. Well, that probably has 10, 12 layers.
Yeah.
Well, the body has about 100 layers. Okay. So when you cut down into that to get exposure to do your surgery, when they're closing,
I've actually sat in surgeries before. I've sat in surgeries where they're closing somebody up, and it's been horrid to watch. Horrid.
So you just want to get a nice closure. You're not trying, and it's impossible.
Yeah.
I mean,
you can't refuse something.
Cellular layers to get all back in line.
Right.
The other thing that people don't understand is that human beings, we start out as one cell. And then we double and double and double, and what's happening every time we do that? We stretch, stretch, right? And you grow, and as you grow, you create tension lines. You create tension. So if you cut anything, it will retract.
Okay.
Right. That's why if you ever seen somebody with a torn bicep, it looks like this. It's like.
It's all bundled up.
And they call that a Popeye lesion, right? It's this big ball because it contracted and rolled back up. And that happens everywhere. So if you cut the skin of the back specifically has a lot of tension in it. And as you cut that, it's going to pull away. So you can imagine trying to line up all those fascial layers, and the fascia has tons of pain in it. There's no question. So in those kind of cases, I look with ultrasound and we do injections along those lines and try to re-stimulate it to get some healing back. And often you can get some real improvement. Someone who's had multiple surgeries is never going to be pain-free.
Right.
Right. That's an unrealistic expectation. But if you can get them to
manageable.
where they're actually having some form of social life and getting out and doing things that make life for them.
And they're not having to take ibuprofen every single day.
Right. Well, if they're taking ibuprofen, they're never going to heal.
Right.
That's been the course of action.
Those are kind of the things on the interventional side. On the non-interventional side, we do have some things that we can do for all those saboteurs, right? So if you have chronic fatigue, if you have Lyme, if you have some chronic infection, EBV, CMV, something that's been sitting in there and you can't shake it, then we have IVs that we'll do, like very high dose vitamin C or Myers cocktails or ozone. I do something I call it the young blood therapy. It's what we do is take your blood, okay? Take it out and you'll look at it. It's venous blood. It looks terrible. I mean, it's dark. It doesn't look terrible, but it's dark.
It's not bright red blood
Dirty
like
blood.
you.
Right.
Yeah.
It's basically dirty. It's deoxygenated. And then you can ozonate it with ozone gas. And as that disseminates through the fluid, it becomes hyperoxygenated, about 50-fold of what it normally would be. And so that's like, I tell people, like, when you see people doing hyperbarics, we call that diving, right? So you do a dive, 1-2 atmospheres. I don't think anybody in town goes more than 3 except Lafayette General maybe. But let's say you go even 3 atmospheres, you're not going to hyperoxygenate the blood more than 3, 4, 5-fold, which is great. It's great, but you're not going to get anywhere near where we get with this. Because you're dissolving it into the blood and then you put it back in. You can see it be super bright red to going back in.
What does that do for your body? I mean, obviously giving oxygen is great, but like, why would you need to do that?
Okay. So this is going to fly. You're going to be like, hold on, this is not right. All right. So oxygen, right, is not just the thing that keeps us alive. It's what kills us. Okay? Because we all die by rusting. We rust internally. It's a consequence of breathing this environment we live in. So when you breathe in, you breathe in O2, right? Oxygen.
Right.
When you breathe out, what do you breathe out?
CO2.
And H2O.
Okay. Yeah.
Oh.
So that those stoichiometrically, that doesn't work.
That makes perfect sense. When I used to run a lot, so I've kind of stopped running, but I had knee problems, and this was early in my 30s, and I'd always feel like it feels like a rusty knee. Like that's how I would describe it. My knee is rusty. If I could just like squirt some oil in there.
Get some WD-40 on it?
Yeah, that's what I wanted to do. I mean, obviously I wasn't going to do that, but that's exactly what it felt like. If you have a rusty joint of something, that's what my knee felt like. It doesn't feel like that anymore. I'm good.
Well, that's good.
Yeah.
but we all breathe. What happens is every breath you take, you're creating an oxygen radical. And oxygen radicals cause problems, let's just say, right? They cause redox reactions in the body. And that is the number one, at least, theory of aging at this point. Okay. So you can imagine if your number one enemy came walking through the front door, you would raise every alarm and get all your friends to come help you beat this person up, or at least remove them from your house, right?
Yeah.
Okay. Because you're going to say, well, this is causing inflammation. Yeah, well, it's causing super inflammation and therefore super healing.
Okay.
So that's what the oxygenation does, is it pulls all of the
hyperoxygenation with ozonides, not with oxygen. So if we had an oxygen tank and I stuck it on your, and just gave you high flow, right? And we looked at your blood, you would go from maybe 98 to 100%, but that wouldn't hurt you. It's not that's not going to produce. I'm not giving you oxygen radicals.
right.
With ozone, I'm giving you oxygen radicals. You may have heard of hydrogen peroxide therapy.
Right.
It's giving you oxygen. High dose vitamin C, it breaks down into hydrogen peroxide, right? So it's giving you oxygen radicals. And why would you want to do that? because the immune system is highly sensitive to that, and it will ramp up like crazy.
We're in this world, like alternative world, I guess, and people come to me all the time looking for high-dose vitamin C because they have cancer and they don't want to do the traditional treatment.
Yeah.
Is that why high-dose vitamin C would be something that they might want to do?
So
I'm not going to say treat
cancer
it.
patients.
Okay, good.
Okay. And the issue, though, is we can have a conversation and no one has to try to throw me in jail or call the patient a moron or anything like that, right? I mean, here's the truth of it is this. Lots of chemotherapeutic agents, in fact, not lots, all chemotherapies act as either a reducing agent or an oxidizing agent. Let's just break it down to chemistry, okay? And that's what it really comes down to is that, so what I tell patients is, we need to have an open conversation of what you're on, what the therapy is, because what I don't want to do ever is to give any therapy that could counteract a therapy that's supposed to be helping you, right? So if they're giving you a reducing agent and I'm giving you an oxidizing agent, I mean, we're canceling each other out, and that's not good for you. We're not killing the cancer.
So what you're doing with vitamin C therapy or any therapy is supporting what they're already doing. You're not trying to
Correct.
to be the primary.
Oh no.
Okay, so you're supporting.
Very well said. It's not
Okay.
the primary treatment. It's and this is written 50 times on all my paperwork. It is adjunctive.
Okay.
It is adjunctive only.
I also want to say that we want to make sure that no one's like drinking hydrogen peroxide to try and do anything to their.
Yeah, this is totally different. You have to do it under the supervision of a physician.
No, come
Okay.
on. That you're right. We should say that for sure. Never ever drink hydrogen peroxide. That wouldn't be smart.
Right.
But what happens with high dose C is that at high dose, at low dose it's immunostimulatory. At high dose, though, it becomes really stimulatory, but not just stimulatory on the immune side. Is in theory, I'm not definitively saying, in theory, high dose vitamin C will produce such an oxidative burden that it could potentially kill cancer cells only. And why? Because cancer cells do not produce, they have no way, to fight oxidative stress. So they don't produce the three big mechanisms in which all of our cells fight our number one enemy, rusting or oxidation, right? The first one is called glutathione. That's number one, the holy grail, right? The second one is SOD, superoxide dismutase, and the third is catalase. So those are your big three that help fight against all this oxidative stress. Oxidative stress, you've all heard, you've heard this thing, but what exactly is it? What it is that it's this free radical. It's a negative ion that's flying around, and it needs somebody to grab it, right? It's like your friend well, I shouldn't say that. Maybe I was going to say it's like your friend who's had too much to drink. Someone
I was thinking the exact same thing.
Like she's got to go. So someone's got to grab her. But what happens is it'll hit a membrane. It'll hit a cell membrane, and it starts to fracture. Okay? It can cause fracture in those membranes. So over time, you're killing, that's what happens. It starts killing cells one by one. So oxidative stress is, and we just call it oxidative stress, but when you take that process of oxidation and go outside, it's called rust.
Okay.
Right? So rust, we all rust from the inside with every breath we take. And that's why an anti-oxidative diet is much more important than the quote unquote anti-inflammatory diet. There's really no such thing as an anti-inflammatory diet. People use it all the time, but that word is really not correct. It's anti-oxidative. And they'll say, well, Tommy, I can measure blood and see the inflammatory markers going down. Yeah, because the immune system doesn't have to work as hard because you're helping it with that whatever, with that supplement, that Juice Plus or that pick one, right? The vitamin C, vitamin E.
Well, so with vitamin C, though, what you're talking about is intravenous vitamin C.
Correct.
So if you take excessive high amounts of vitamin C by mouth, then it's going through your digestive tract and not necessarily getting absorbed.
Yeah. So the studies on that, Linus Pauling did some great work with that. And what you find is that you'll just poop it out.
Yes.
Okay,
And you'll
so-
probably have diarrhea.
Yeah. In fact, part of his protocol was that you take a gram a day and increase by a gram a day until you have diarrhea, then back down a gram.
I've actually done that with people before.
Yeah.
We
Yeah.
finally brought up poop again. I'm so excited.
It's usually the Easter egg in every episode. We
Yeah. Poop.
been a while.
somehow
Yeah.
bring up poop.
Well, poop is super, super important.
Yes,
Yeah.
it is.
Super important.
Yeah.
But that's interesting. At that point, you're only 1 gram too much,
Well, the problem though is that,
but you're still not getting.
you're not.
It's not doing what you're talking about
You're
whenever
not
it
getting
goes.
to that
Right.
That's just as
that
much as your
level
body.
in the
Right.
bloodstream, and they
Right.
did some pretty good studies to show that. Doesn't mean that oral vitamin C can't help you from an oxidative perspective,
Okay.
right? So it is an antioxidant, and it can help you decrease. The way I say it is this: so like pick one, pick any of your inflammatory mediators. Classic one is high sensitivity C-reactive protein, HSCRP, right? So if I pulled your blood right now and we looked at HSCRP and it's up, I'm like, oh, you're inflamed. Yeah. Doesn't tell me why you're
Anything, yeah.
inflamed and who's the culprit causing the inflammation. It's just that your immune system's pissed and it's fighting something right now.
And that's all of the inflammatory markers. So SED rate.
All of them.
Yeah. Okay.
Oh, see, that's whenever I had my blood test done, whenever I had my Achilles, when it popped, that was one that was high that I remember asking y'all about. And I think whoever was on, I don't know, but it was just, it's inflamed. Like, you popped your Achilles. You're probably inflamed. Like, there's just a bunch of things that it could have been.
Yeah. Well, because some of them are called acute phase reactants. So anything that happens acute in the body, like, oh God,
Yeah.
they all come up. Like, it's just emergency.
How long, just theoretically, how long after that blood test would it take for it to get back to normal?
That's a trick question
Okay.
because with a trauma like that,
It's probably going to stay.
it's going to stay elevated because it's ongoing.
But let's say there was no physical reason. It's still a trick. Like, you still got to figure out why.
Yeah, I mean, if you're just inflamed you're always going to be inflamed for a reason.
Yeah.
There is a reason.
Okay.
Okay.
So those markers are just telling you, it's just confirming, yes, you are inflamed. And
Yes.
now we have to go on a scavenger hunt and try and figure out what is going on.
Don't take anti-inflammatories.
Right, because that won't work.
That's
that won't
crazy.
work. It won't work. It won't even knock down those markers because those are acute phase reactions. Those aren't actually in the inflammatory pathway of the immune system. So it's this pathway over here that the COX inhibitors work on, right? So, but what's interesting is if you take antioxidants, I mean, just had a big article come out with omega-3 fatty acids, specifically DHA and EPA, not fish oils, not krill, for God's sake. And what they showed is that it's the same old study that everybody does, is that it decreases all your acute phase reactants. Okay, great. Does that mean that it's curing the source? No. It just means that it's helping the immune system so that they don't have to get so upset about whatever's going on over here. They don't have to get so upset that you have another team coming in to help. Right? So it's like if we had a hurricane, you have these outside folks come in to help clean up. Well, then, we don't have to have police officers helping people clean up.
Right.
They can be guarding the bank or
Right.
doing their patrols, whatever they're doing.
Yeah.
So that's why diet and supplementation are important. If we had the right diet, conceivably, you would never have to supplement. But I've not seen that yet. It's very rare to find somebody that doesn't have some deficiency somewhere.
Not to mention the quality of our soil today
Yeah.
is garbage. So our food doesn't even have the nutritional value that it used to anyway. So
That's why we need regenerative farming.
yes.
So not just regenerative medicine, but regenerative farming. I'm a big believer in that. And if if you guys haven't seen Joel Salatin's work,
Mm-hmm.
he's
Yeah,
fantastic.
he's big in the Weston A. Price that we talked about last week.
Yeah. It's fun. He's fun to watch. He's very enthusiastic about
The
his
lunatic
work.
farmer.
The lunatic farmer.
Yeah.
He is the lunatic.
That's awesome.
So we talked a little bit about regenerative interventions that we do for orthopedic injuries, which is my main bag. But then in always trying to get that better with better outcomes and more efficient healing, and is to look at this other bag. And that's what the rest of our practice is, which you've had Ashley on, and Ashley is part of that piece in trying to optimize health.
Mm-hmm.
And in optimizing health, you're going to optimize immune function, right? So when you optimize health, you optimize immune function, you optimize the ability to function better. So, when we started this podcast asking me, what is regenerative medicine? Well, what is functional medicine? What is integrative medicine? What is, functional orthopedics? I made that up 10 years ago. Maybe what do I do? I'm certainly, no offense, I'm certainly not a family practice doc, right? I'm not an orthopedic surgeon. I am boarded in sports medicine and orthopedic medicine. I do some pain management in there. It's like if I inject a spine, if you inject a knee, they call it sports medicine. You inject a hip, sports medicine. You inject a spine, pain management. Like what?
Right.
Who came up with that? That doesn't make any sense. But so when people ask me, what do you do? The best thing that I feel I can say is regenerative medicine, because I think that's what it is. It's regenerative orthopedics and it's regenerative medicine, right? Now, we'll have to have another episode about, the other pieces. So you can use these techniques in other parts of the body, specifically in the sex organs, right, in the genitourinary tract. So, we can use, what do we call it? Blood juice concentrate?
Yeah.
We use the BJC for women and men to regenerate both the clitoris, the vagina, and the penis. Probably on the male side, I would say it's 75%. Women, it's damn near 100%, but not on the sexual side. It's for stress incontinence. So women who have had vaginal deliveries and have some stress incontinence, there is no good therapy or procedure for them. Even the surgeons will say, well, we just try to sling it up a little bit, and you're still going to have some loss, urine loss. But with using the BJC technique,
We're going to confuse everybody.
I know this is not good, but using some growth factors, we can really help the sphincter regain control, and we've had great success with that. I'm serious. It's got to be 99%.
So we didn't really dig into really what PRP and stem cells are and what they do, and we're probably running out of time. But I was listening to your podcast with Jan Swift, and you were talking about how regenerative medicine is basically helping the body with its innate ability to heal itself. And I go back and forth being in a kinesiology program, but I do too much. Anyway.
Don't we all? Trust me, I get it.
But I took this biology class, and it was like more like medical biology versus just like biology 101. And it was so amazing to see how the body was so divinely created, and it just really does regenerate itself if given the proper environment. I don't want this episode to end without you talking about, I guess, what those components are.
So I love the way you said that. The body, I love the word innate, because you don't have to think about things that are innate. You're not thinking about heart taking another beat right now, right? That's all automatic. You scratch yourself, you don't have to think about it healing. It is going to heal. It wants to heal, right? So what is healing? One of the things, what I hear you asking in that is, what are some of the principles or requirements of healing, right? What does it need? What does the body want? What does it need? It needs time, and it needs the proper time, the proper stimulus. And that stimulus could be, that might have 5 fingers coming off of it, right? Nutrition, sleep, hydration, the cofactors to make the proteins that are going to, become the collagen in the torn tissue. All these types of things. The most interesting thing, I was going to say, the third thing is energy. Now, what's most interesting to me as a guy that's done this for 20 years, I'm injecting people with cells and growth factors and hormones and trying to get this immune system to come back and heal this damaged tissue. What's super interesting to me is the idea of energy. This is the holy grail. It's the next adventure in medicine. And I hope we get there, not too soon because I still have a family to feed. But if you can imagine that there are specific frequencies and intensities of different energies that could heal human tissue in an instant. There are case reports of this, right?
So you say energy as a dietitian, the first thing I think of is calories, but that's not at all what you're talking about here.
I'm talking about electromagnetic energy.
Okay.
Right? Okay. So wavelength, amplitude, power. Another way to think about that is, all of us right now are made up of the physical, trillions of cells that stay together in this thing, I call it the body. It's your body
meat
suit.
Sack.
Your body suit, your meat sack, right? This is your life suit, right? And what we've proven in physics is that we're all vibrating, right? So we're just energy that has slowed its vibration down to a point that it allows coalescence. But if we were to vibrate at some certain frequency, and who knows, we would all fall apart and we'd all dissipate, in theory, right? Yeah. So when you look back, again, always history teaches us so much, and especially this generation of folks with podcasts and the entire world in the palm of your hand. Not many people take the time to go back and look at these quote unquote ancient techniques or ancient therapies. I believe there's likely healing in sound. Mm-hmm. There's healing in vibration. There's certainly healing in light. Mm-hmm. How is it that a tree, which is a living thing, it's a living organism, it can create energy through photons? Mm-hmm. Now, let's just have a thought experiment. If you believed in evolution, you believed in evolution, even if it was just intelligent design, right? God made the trees, he made the earth, the mountains, the trees. Then he made us. Y'all are having a moment in Tommy's brain, okay?
Love it.
Why? So what's the correlate of chlorophyll? What's the human correlate of chlorophyll? Well, we don't really know, but why wouldn't hemoglobin be able to do the same thing? Or at least come real close? Okay, well, Tommy, that does make sense because it would have to be in the skin cells. Or have exposure. Well, what else has exposure? To the sun. Your eyes do. Mm-hmm. And they get sunlight. So the retina actually does have certain opsonins, right, that look just like chlorophyll. Now, what does that do? What does it mean? I mean, we'll go way deep, but my point is that I believe there is physiology in the body and biochemistry that reacts specifically and only to sunlight, that we're not quite there yet. We know that the sun entrains our physiology through circadian rhythms. Right? That much we do know. And we know it certainly does in mammals. I mean, it controls their sexual behavior. It controls their, full moon, everybody's howling, everybody, right? Mm-hmm. It controls their behavior. So if it's controlling their behavior, it controls their physiology. So there is something there. I'm just starting to scratch the surface on this, but I believe that, we've been lied to a lot. And one of those things is the sun.
Yeah.
And we need the sun.
Yeah.
Red light therapy has gotten so big because, what they've done is made every screen blue.
Mm. Usually I'm wearing my blue blockers, but I forgot them today.
So, and we know that has effect on people, right? Mm-hmm. We know that screen time, we absolutely know that more screen time equals more depression and more anxiety. Mm-hmm. So what that proves is that electromagnetic energy through the retina changes your physiology.
Right.
Mm-hmm.
Right? So why can't it change it for the better? We probably should leave it there because I'm going to go off on a tangent.
We're going to have you back to dig into light.
Imagine, and this can be off the record or whatever, but church bells. Why did they kill all the church bells? Mm-hmm. What happened there? Why would they do that? I don't know, but why? Obviously, it was crazy expensive. They took millions of church bells and cracked them and buried them in the earth. Why? Why would you waste all that? I mean, maybe because they were at 440 or they were at 358 and that was healing frequency.
Mm-hmm. Yeah.
Who knows? I don't know the answer, but I do know that you shouldn't just forget about those things.
Mm-hmm.
Right?
1000%.
I think in the future, we're going to have chairs that we sit on, beds we lay in that will vibrate at certain frequencies and re-energize you, heal you, maybe combined with some type of light. We'll see. But I think that's going to be big. I really do.
Feels like probably not too far away from that.
Well, I almost feel like they've got it.
Yeah.
And they won't put it out.
Speaking to the conspiracy theorist over here.
Yeah.
I just got back from the Eudaimonia Summit. I don't know if you know what that is. It's where all the health and wellness nerds come together, and they had a whole marketplace in the middle where everyone's selling everything. They had so many, the red light this and the whatever, but they had this one chair that you lay on and you listen to music, for lack of a better term, and they flash these lights with your eyes closed at this certain frequency, and it's supposed to heal all sorts of stuff. And I took a picture. I'll send it over to you.
Did you do it?
Yeah, I did.
How'd you feel when you got up?
I was very intrigued. I want to learn more about it.
Yeah.
But I'm a huge believer in the sun, and my mother-in-law is a Reiki master, and I'm training with her to do that. And we have sound baths here. So you're speaking to the choir.
I think if anything, the last 5 years has certainly taught us, or at least it should have, that it doesn't matter where you are politically. What happened in the last 5 years was so wrong, so incredibly unethical, so incredibly wrong that it doesn't matter if you love Joe Biden or you love Trump or you're somewhere in the middle. None of that matters. We're talking about human beings and the unethical way that this whole thing was run. I mean, if COVID taught us anything, is that they will lie to your face, and not just lie. They will, do everything except shoot you, to put you down an unethical pathway that's dangerous for their own benefit.
Yeah.
So You can call me a conspiracy theorist. From day one, I said, this is no way. I'm not buying this. And it was mainly because I knew about MERS when it happened, in 03, or was that, it was 01 and then 03. Yeah, it was like 03 or 05. Then MERS came out and it killed 13,000 people. And you're telling me this thing is all of a sudden just popping up and it was a pangolin? I'm not sure.
So before we let you go, we always ask our guests one last question. It's, what does living vividly mean to you?
Living vividly, first of all, I love that. And living vividly means living optimally. And I think that's what we should all be striving to do. And there are many pieces to that. One being health. Two being one being love, right? Love conquers all. Love conquers all. I'll say it again. 2 being health. 3 being mental stimulation, motivation. That's a big one for folks that I see that retire. If they don't have a plan, then they can get depressed because they're not mentally motivated and stimulated. But those the whole biopsychosocial model of the human being is what I believe living vividly is.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.